As we continue to explore the vibrant intersections of culture, health, and innovation in Bhutan Echoes, it's my pleasure to introduce our next session, the 6 Musketeers of Lifestyle Medicine. This promises to be an enlightening exploration into the ways we can enhance our lives through intentional health practices. Leading this discussion is none other than Dr.Yongyuth Mayalarp, a renowned figure in the field of public health and lifestyle medicine. With a storied career that spans continents and disciplines, Dr. Yongyuth brings a wealth of knowledge and experience in our festival. He graduated with an MBBS from the London Hospital Medical College, followed by an MSc in Clinical Tropical Medicine from the London School of Hygiene and Tropical Medicine. His medical journey has seen him serve at prestigious institutions such as Prangmukudlao Military Hospital and PFI 2 International Hospital. Not only is Dr. Yongyuth a board-certified physician in anti-aging and regenerative medicine, but he's also certified in preventive medicine, lifestyle medicine, nutritional wellness, and sexual medicine. His dedication to improving public health has earned him the royally bestowed Thepthong Award twice, and today he serves as the Deputy Dean of the Center of Integrative Medicine at Dukrakej Pandit University. So without further ado, please join me in giving a warm welcome to Dr. Yongyuth Mayalarp as he takes the stage.
Thank you very much for inviting me to be on the stage today. Very pleased to be here. Very excited as well. My name is Yongyuth Mayalarp. I work as a lifestyle medicine physician and anti-aging medicine physician as well in Bangkok. And I work a lot on television and radio. And I run an association called Thai Lifestyle Medicine and Wellbeing Association. Lifestyle medicine is something quite new in Thailand. Being on the stage as the only Thai citizens for these Bhutan Echoes, I bring you greetings from Thailand, from my Thai friends to all the Bhutanese friends who've been having cordial relations for a long, long time between our two peoples and our two countries. I was a bit worried talking about lifestyle medicine and medicine particularly because your festival is about literature and art. But then I think about it, doctors, surgeons, for example, they use not only the science and medicine knowledge, but they also use the skill, the talent, the art in suturing up the wounds, in doing the operation. And the physicians, they work on the medicine. They blend the various therapeutic measures together to be appropriate for that particular patient. So there's art in medicine, of course. So today I'm going to talk to you about lifestyle medicine. This is something quite new. I have known Bhutanese citizens for a long time. I used to work at Payathai 2. I'm in the Payathai group of hospital, and Payathai 2 is a hospital where a lot of Bhutanese people come for their treatment, and many come for delivery of their babies. So I think about 500 or so babies, Bhutanese babies born at Payathai 2 hospital in Bangkok. So if we have a gathering together of all the Bhutanese children born at Payathai 2, I think there will be a substantial number. Lifestyle medicine is something new. Before we go on with the next slide, let me just capture for you what it is the lifestyle medicine means. Lifestyle medicine tackles the cause of many chronic diseases, chronic non-infectious diseases like diabetes, obesity, high blood pressure or hypertension, and hyperlipidemia or high blood lipid in your body. And that bring on many chronic illnesses. Now, lifestyle medicine tackle at that particular point. Okay? In the past, we have doctors prescribing treatment to the patients. Patients take the drugs, go home, and just take the medicine. But the lifestyle, which may not be conducive to good health, still exists. They still continue smoking. They still continue being sedentary, not doing very much in everyday life, not eating healthy food, for instance. So lifestyle medicine want to change that. But to modify their lifestyle is not very easy. Something that needs to be tackled skillfully. The doctors and the medical team need to know how to talk to the patients, how to get the right information from them. If you visit the doctor's clinic in Thailand, we have a lot of patients coming to the government hospital for their treatment. And they spend only about 5 minutes, 10 minutes per case. It's a very short time. You can't do any lifestyle medicine modification there. You need many visits. You need engagement with the patient. You need trust develop with the patient, because the patient needs to trust you to change their lifestyle. So there's a big work. So you need to change the approach, the medical approach of the doctors and the medical team. The other thing is that it's a long-term treatment. To be able to change lifestyle, you need months, years, and you need to tackle each homework one at a time. You can't do everything in one single visit to the hospital. You need a number of visits. Okay. So let's have the first slide. I'll tell you a story. The one on the left is the London hospital where I graduated. It's in Whitechapel. That was in 1983 when I graduated. The one on the right, the same building, but different facade, is in 1990. And it's now called Royal London Hospital because it became, it's been given the word royal by Her Majesty Queen Elizabeth II when she visited the hospital in 1990 when the hospital celebrated 250th year of this establishment. The next slide, please. I introduced you to two persons. The one on the left is called Mr. Joseph Merrick. He was born in 1862 and he died in 1890, very young age. The one on the right is a surgeon, worked at the London hospital. His name is Sir Frederick Travis. Okay. Mr. Merrick was born a normal person, and he became abnormally like this, gradually developing enlargement of the bones, of the tissues, of the joints, of the skin, everything become larger when he was 5 years old. And this abnormality increased since then, and he became a weirdo, a strange person, and he was attracted to the circuses. He traveled with circuses and do performance and get some money, but he was quite badly treated by the circus owners. Their story reached Sir Frederick Travis, who's a surgeon at the London hospital. So out of curiosity, he invited Mr. Merrick to the hospital. Now to get to the hospital, he had to wear a big mask and big cloak to cover himself up, because otherwise he'll be pelted with eggs and bricks, stones by the children along the street of London. So he has to conceal himself. He arrived at the London hospital, be examined by our doctor here, as well as about almost 100 other doctors in a theater, 2 levels. You had the balconies as well. And he was stripped naked. He was very embarrassed. And people could not communicate with him because of his jaw, the difficulty in his oral cavity. It was all abnormal. People thought, and including the surgeon as well, initially thought that he probably has low IQ. But in fact, it's not. He has very good IQ, but he could not communicate. Both of them did not see one another for many years after that. And he still continued to be mistreated. In the end, Sir Travis, for some reason, invited him back to the London hospital. This time, he offered accommodation to Mr. Merrick, who is now known as Elephant Man. There's a film called Elephant Man, made about 20 years ago about him as well. And with his life in the attic at the London hospital, everything developed gradually. The surgeon spent every Sunday afternoon talking to his patient, getting to know him. Only one person who can understand Mr. Merrick is Sir Travis. In the end, he decided to make an operation on Mr. Merrick and make his mouth move more freely so he can communicate with other people more effectively. He became a celebrity, in fact. He started wearing suit and everything. He was visited frequently by members of the royal family of the British Empire at the time. He confided with Sir Travis that one day he would like to have a wife who live and stay in an institution for the blind so that his wife could not see what he looked like. And he also dreamed of lying on his back to sleep because he never able to do that. His head is too big, and there was always the risk of breaking his neck. One day when he was very happy. He had very good positive psychology, very good social connection, and also he doesn't have much stress at that time. He decided one night that he'd go to bed lying on his back, just for one in his life, and see what happened. I don't think he'd tell anyone about that, but the next morning they discovered him dead because his trachea broken. I know him very well. I know Mr. Merrick very, very well. I spent a lot of time with him as a skeleton. He's in the glass cabinet next to the table I was working in the museum at the London Hospital Medical College. I spent my lunchtime there revising my books, and he was accompanying me on the side. So I know a bit about his story. This reflects a very lovely story of the patient and doctor relationship. Something, if you imagine Victorian time, doctors prescribe treatment with doctor-centered approach. Now, this is something strange. You have here a patient-centered approach. And the doctor has managed to nurture the positive psychology and the social connectedness of this patient, and also help promote stress management for him as well. And these are all the pillars of the lifestyle medicine that we have witnessed, perhaps for the first time in the history, way back then. Next slide, please. So, non-communicable diseases, NCDs, is causing a lot of death, 41 million each year, equivalent to about 74% of all the death globally. And because of what? Unhealthy behavior, the eating pattern, the stress, the lack of sleep, and maybe you resort to some smoking, alcohol, narcotic substances, and you don't have positive outlook to life, for instance. So the next one. Here you are, the lifestyle medicine. This developed by American College of Lifestyle Medicine over the last 20 years. They collected all the components that bring about change in your lifestyle for the better. They talk about the healthy food, the plant-based diet, whole food, something that you have a look at and you recognize what this food, where it comes from. You can see it as meat, you can see it as fruit. Bananas do look like bananas, not like ice cream, which is processed. And you talk about the physical activity rather than physical exercises. You don't need formal tracksuit. You don't need gym shoes to go on running 10 minutes a day or whatever. But you need constant change of your behavior. From sitting down, you need to change and walk about. And that's physical activity that we require. You also need to manage the stress various ways. You also need to have good relationship in the society. And you need good sleep. And you need to avoid the risky substances. Those are the 6 pillars of lifestyle medicine. Stress management, very important, is unavoidable. What you can do 2 things. 1, you reduce your stress. Secondly, you alleviate the stress. You increase your exercise. You increase your activities. You increase your relaxation activities. Those are the things. You can also make use of those things that I mentioned, the nutrition, the physical activities, the sleep. All these can help in reducing your stress. Plant-based diet can do wonders on the stress as well. Nowadays, we talk a lot about mind and body practices. You have the yoga, you have the biofeedback, you have various kinds of meditations. These have shown to reduce your stress significantly. And in fact, if you practice it regularly, it reduces and induces the relaxation responses. Your blood pressure go down, your heart rate go down. The spiking of your stress hormone, the cortisol, goes down in frequency and intensity as well. And you can have better control of your diabetes and your blood sugar. And if you continue it regularly for a long, long time, there's evidence to show that your hippocampus and your left prefrontal cortex will become larger. And also your amygdala inside your brain works better. And what does mean? It means your cognitive function is better, your affective benefits occurred. So that's the stress management. And we now talk about mindfulness quite often. That is to look at yourself, intentionally focus on what you are doing right at this moment, what's happening inside you and just around you. And you make that particular focus, it can bring about the stress relief. You can focus on things and forget difficult things, negative things that's happening around you. So that's something that we are promoting. Physical activity, I mentioned, you need just to change your habits. If you can move regularly, you have less of the incidence of various morbidities. And the next slide will show you that if you sit still, your all-cause mortality will go way up. You are in the red zone. But as soon as you stand up and start to walk, you enter into your green zone. and your all-cause mortality rate goes down significantly. For this next slide, please. Whole food, plant-based diet. The evidence shows that if you're eating whole food, plant-based diet, not only that, you've got all the vitamins, all the minerals, the phytochemicals, you've got the protein, the fat, the carbohydrate, your fibers, but you also have a lot of other things like the promotion of your immunity. You also have less of the inflammation in your body. Fat cells produce mediators for inflammation. That means if you have big belly, you have a chance of having a lot of inflammation lurking about in your body. And that makes your cells become old quicker. So you can become older if you have too much of the fat in your body. So whole food plant-based diet is very useful for that. It's also good for your gut health. That means you can have your gut producing good balance of the good and bad microbes in your bowel, and that will make your immunity better, and you can control your weight better. And also, it will reduce down your cholesterol. You have good control of your glucose. So with plant-based diet, you can have less of the incidence of the heart disease, of the strokes, of the diabetes, and also some of the mental problems as well. Alkaline diet. If you make yourself, your body, tissue, being in the environment of alkalinity, that's good for your body. That means if you eat more of the vegetables, particularly those on the right-hand spectrum, the broccoli, Brussels sprout, cabbage, cauliflower, and so on, you have a higher pH, alkaline environment. What happens if you have acid environment? Like we eat too much meat, you have acid environment. Then you are conducive to having osteopenia, or the loss of your bone mass, because the body will try to neutralize this acidity by bringing out the calcium from your bone. So you become, you're having thinning of the bone, the osteopenia. And you will have the environment conducive to having cancer as well, if you have acidic environment. And next one, just a study to show that when you get a group of people eating ultra-processed food, comparing to unprocessed food, the same group of people, 2 weeks with unprocessed and 2 weeks with non-processed, there's significant difference. With the ultra-processed food, it's probably more delicious. But what will happen is that your body weight goes up, your body fat mass go up as well. So that's not very good for your chronic diseases. Cessation of smoking and avoidance of risky substances. Nowadays, we found that the people who can stop smoking are increasing in number all the time. It's very encouraging. The thing is, you need to give them support. The thing is, many people who have not yet stopped smoking realize the hazard of smoking, but they don't know how to start. They don't know how to take action to stop. So the doctors and the team need to engage the patient and learn about their story. Each person has different reasons for inspiration to stop something like this. Maybe their children, maybe because of important religious events coming up. These sort of things that the doctor needs to find out and need to encourage them to take the first step. Sleep, crucial for human. We spend a lot of time sleeping, but we tend to go to bed with our tablets and also the mobile phones. We tend to bring our notebooks onto the bed to work. That's not very good. We need a good sleep, and that will help a lot with a lot of diseases. And how we do that? Basically, you have to make sure that you have enough time outside to get enough of the sunlight for your hypothalamus to register that you have adequate sunlight during the day, and that will reward you with enough of the melatonin at nighttime. The melatonin will help you sleep. It's an anti-free radical, so it's very good in counteracting any stress that may happen to your body. So you need good melatonin level at nighttime, and that can result from having time outside in the sunlight. But when the evening time comes, try to avoid light, because that will interfere with your sleep. That means that if you look at your tablet with artificial light coming out from it, that will disturb your sleep significantly. So you have to be careful with that. With your mobile phone and your tablet, you need to charge them outside your bedroom. You need to be having very dark room, very quiet, good temperature. And before you go to bed, don't drink too much water. Try to calm yourself down. Instead of looking at the iPad, you may use colorful books and imagine that you're going to go on a holiday next month to various places, and that will urge you to relax and go into the good mood for the sleep. Basically about this, okay? This just to show that there's a circadian rhythm involved in all this. The body is made up so that the hormones and all the gastric juices are ready to work in the morning, at the time when you wake up and you start to eat. And after that, all these hormones and gastric juices will go down. Other things will come in place. The insulin will start to work more and more to try to save some of these energy in the form of fat, in the form of protein, whatever. So if you're timing your eating correctly, and now we are talking a lot about intermittent fasting, IF, it's very beneficial. And it's appeared to be that IF may make your life longer even, okay? So that's just to show you that there's an orchestral functioning of all the hormones together, and you need to look after that well enough for it to work well. Positive psychology and connectedness. Well, there's a story, very interesting. The only positive factor that makes you happy and you live longer from the study is that the social connectedness. There was a study carried out on the Harvard students, male Harvard students, 268 people, that graduated in 1939 to 1944. And at the same time, they conducted another study on male people, 456 in number, in the Boston city. And they followed these people for 75 years. And they discovered that the only predictive factor for happiness and longevity is social connectedness. Psychiatrists say that you take vitamin C every day in the morning to make sure that you're having enough antioxidant to deal with all the free radicals and the stress in your body. But you also need social connectedness every day as well, just like you need vitamin C. Now, we're coming to the last part of this talk. I just mentioned quickly about telomere. Telomere is something that can predict your longevity. I'll tell you a moment what it is. But first of all, let's just look at this. This is a study on Buddhist monks in Thailand, 100 of them. And compare that with Thai males of the same age, 100 of them as well. And they found that the Thai monks have longer telomere on average. Next slide, please. What is telomere? That is a telomere. Okay? It's a DNA strands that come out at the end of your chromosomes. Every time your cells divide into two, you have to copy your chromosomes, 23 pairs of chromosomes, into another set of 23 pairs of chromosomes. And then the cell will divide, and you have 23 pairs going to one cell, and the other 23 pairs going to the other cell. Every time you divide your cells, this telomere gets shorter and shorter. It serves as a handle. When you want to split the two sets of chromosomes apart, like zipping, unzipping, you handle onto, you grab hold onto this particular telomere. And each time the cell divides, the telomere will get shorter. For fibroblast cells, this will go on for about 50 to 70 cycles. And then it will go into senescence, which means the cells stop to divide because telomere is too short. But if you have bad lifestyle, you drink too much, you sleep not so well, you don't exercise at all, your telomere will go shorter very quickly. And that's how you assess your longevity. That's one of the ways that you can measure out into figures. I measure my telomere every 6 months, and I can foresee what my lifestyle should be adjusted during the next 6 months to make my telomere a little bit longer. But we have tendency for the telomere to become shorter with time goes by. You can see that centenarians, those who live over 100 years old, have higher, longer telomere than those who are not centenarians. Okay? Last one. Just to recap the takeaway, focus on the whole food plant-based diet to promote overall health and prevent chronic diseases. I would suggest encourage regular exercise to improve cardiovascular health and the well-being and the weight management, and prioritize on the adequate and quality sleep to support physical and mental recovery and the optimal functioning. And utilize techniques like mindfulness, like meditation, relaxation to reduce the stress and improve resilience. And you should eliminate or reduce the use of harmful substances like tobacco, excessive alcohol, and drugs. And finally, foster supportive social connections and community involvement to enhance the emotional and mental health. Thank you very much.
It's on intermittent fasting, because my parents, they do practice that. And
Okay.
they're like, there's different kinds of intermittent fasting. I'm wondering, like, what's your take on it? I know that, like, for example, like for teenagers who are still in their like growing stage, I wonder if fasting is the right thing for them. But like for adults, like that may be a different case. And if they do it, like, how do you suggest going about it? Yeah.
I think it's still early in the in early days at the moment for getting all the information. We know that if you have intermittent fasting for 8 to 10 hours, for example, from the morning time, 7 o'clock or 8 o'clock, until about 2 or 3 p.m. in the afternoon or something like that, it is beneficial. It can reduce your weight, provided that you don't eat confectionaries or drink alcohols or eat sweets after that. Then your energy intake will reduce. And the markers for your metabolic state will be much better. Your HbA1c, whatever, will be much better. On the other hand, if you do the same, 8 o'clock to 2 o'clock in the afternoon, whatever, but you still have confectionaries and everything else, your weight will not go down. But you still can get benefit from all these markers. Okay, you can see that your cardiovascular system on the improvement. However, if you decide to fast from midday and run until about 8 o'clock at night, your weight will be still the same, and your benefits on the markers will not appear. So it seems at the moment that it may be better to do intermittent fasting in the morning and finish like a monk at around lunchtime, and then try to keep it low for the rest of the day until the next day. However, we don't know, we haven't had a study on the food, the type of food you eat during those 8 hours. Nobody have actually finished the study on that yet, because we need to control these particular confounding variables of what you eat and how much you eat. Because at the moment, most of the studies conducted did not control the calories that you intake during those 8 hours. And for children, I think it may be too early to impose intermittent fasting on them because they're on the growing phase.
Yeah, so like it seems like you're recommending that like if we do intermittent fasting, it'll be like from like morning 8 a.m. to noontime or like 1 or 2. That'd be
That's right.
healthier.
Yes, about 8 hours, maybe starting from 7, run until about 3 in the afternoon, and then after that you try to fast. You can drink water.
Oh yeah, definitely. Yeah.
But monks, many monks, they drink in Thailand. They drink sugar water at about 6 o'clock in the evening, which may disrupt your intermittent fasting to a certain extent. But maybe I think it still produced the result as you can see here. And a lot of monks in Thailand, and I'm sure a lot of monks in Bhutan, they have very good longevity. Many of the monks in Thailand live over 100 years old. It would be interesting to conduct a study here in Bhutan and see what the monks here with their behavior resulted in. Okay. Any other question, please? For the men, okay, when you become older, like me, I'm 66. I have a 6-year-old daughter over there. So I had her when I was 60. And you need to look after your male hormones, very important. From the age of 40, your testosterone will go down about 1% a year. If you look after yourself well, that means you exercise, you have good food, healthy food, and so on and so forth. You will not enter into something called andropause. Andropause is similar to menopause. Okay, ladies got menopause because the ovaries stop functioning, and it's irreversible. But men can go into something like that as well, but it is reversible. Depends on what you do with your life. The testes can produce testosterone hormone until you are 80 or 90. So men of the age of 80 or 90 can have children if you look after yourself well. Now, the way to look after yourself well, first of all, you have to realize that you are having problems. First of all, you have early morning erection automatically when you were young. And it may reduce down to about 6 mornings a week, 5 mornings a week. But what happens if it suddenly turns to 0 a week? That may mean that your hormone need to be evaluated. Another thing is your companion, your wife, we notice that you change. You become grumpy. You become a little bit pale, a little bit yellowish, because testosterone hormone stimulate your erythropoietin and produce the red cells. So if you're short of testosterone, you become anemic. So you become grumpy. You complain of everything. That's a sudden change in your character. And you need to assess your testosterone. You want to keep your testosterone good. That means your brain will work well. Your memory will be good. You have leadership. And you have determination. You have everything. You have good muscles and everything. And you can be leader of the family effectively. So testosterone is something you have to look after. And you can do that by cardiovascular exercise plus weight exercise. If you have muscle mass, your testosterone level will be good. And if you eat things like broccoli, Brussels sprout, cabbage, cauliflower that I mentioned, all these cruciferous vegetables, they're good at maintaining your testosterone. It's good for the ladies as well, because it will prevent the flow of estrogen into the estrogen metabolites that may induce cancer. So these are very useful vegetables, cruciferous vegetables. For men, apart from exercising like this, zinc is very useful because it can block the fat cell. The fat cell produces aromatase enzyme. And if you have big bellies, the fat cell will produce a lot of aromatase enzyme. And this will change your male hormone into female hormone. So you see that male who got big bellies also got big breasts as well, because this is called gynecomastia, because you have the dominance of estrogen over the testosterone. So you need to correct that. First of all, you have to lose weight. Secondly, you take these cruciferous vegetables, which will help blocking aromatase enzyme. And you take zinc, and that also block aromatase enzyme. And for men, when you become older, try to use the underpants that is good for ventilation, not the tight ones, because the testes is designed to be outside your body so that its temperature is slightly lower than the body temperature. And when it is lower than, the temperature is lower than the body temperature, it produces testosterone hormone quite well. And that means if you do the cycling, men particularly, you have to stop after about half an hour to relax and get the temperature down a bit so that it will not affect your testosterone. For ladies, you're going to go into menopause at the age of 45 to 55 or whatever. There's no predetermined time when you go into menopause. It's different for different person. But you can prepare yourself for it because your estrogen that will go down is important for brain, heart, and bone. So you have to have checkup for your heart. You have to have checkup for your brain. But more importantly, checkup for your bones. You need to have a good bone density before you enter menopause. If you're in the country like Bhutan and also Thailand, you don't expose to sunlight very much. Here because of the weather, but in Thailand because they're afraid of the sunlight, so they work indoors all the time. And if I measure their vitamin D levels, it would be low. And on the long-term basis, this can bring osteopenia, the loss of the bone mass. So this is not very good for ladies who are going to enter into menopause in the near future. So that's just some tip to. Okay, thank you very much. Thank you.